I'm Ken Kummerfeld. I'm one of the staff cardiologists at CHRISTUS Trinity Clinic, and it's on my heart today to share a personal story about why I went into cardiology. When I was about 16, my grandfather died, and it was in the late 60s in Los Angeles County, and there was very little that was being done in terms of cardiovascular care at that time except for as-needed nitroglycerin. And so he never had a heart cath or any further care from there. If the technology would have been there back in the late 60s, he could have had a heart cath, and if he probably lived in Houston, he probably would have had heart surgery. But what he could have done on a personal preventive basis is probably done a lot better job on his cholesterol. Although he was a thin gentleman, he worked hard, and he just had a congenital high serum cholesterol. But in that time, there were no drugs for lowering cholesterol that were very effective. I'd say that diet and exercise are the most important issues, to the point that we have a lot of people coming in now that are short of breath, and they're short of breath because they're deconditioned from the COVID isolation. And so sometimes solving those things is as simple as just being on an exercise program 3 or 4 times a week, and then being attentive to blood pressure, diabetic control, high cholesterol, the appropriate treatments for that, and we have a lot of opportunity to intervene.